Hello Tanzania, hello guys. My name is Jacob Wilson. I'm with your nursing and medical session online on YouTube. Today is Saturday of 29th December. As our normal timetable says, today we're going to have midwifery studies, whereby it will be a second session. And our second session of today, we're going to have a study concerning, the topic will be concerning cultural and social issues affecting pregnancy and motherhood. You're most welcome to be with me, Jacob Wilson, your modulator, a registered nurse by profession, and our session is going to take only 15 minutes by time. You're most welcome to be with me. Thank you. As I told you, we are going to have nursing and medical sessions. Our session of today is cultural and social issues affecting pregnancy and motherhood. Cultural and social issues, our learning text will be as follows, whereby we have to understand the following. The first thing is to explain taboos, customs, and beliefs affecting pregnancy and motherhood. The second thing is to select recommended taboos, customs, and beliefs affecting pregnancy and motherhood. And the last thing is to encourage women on avoidance of harmful practices that affect pregnancy and motherhood. When we talk about taboo is a general agreement about something or to do something. It's when the whole society agrees on how to do something in a common way, in a way that all of them will do it. That's the real meaning of taboo. And when we talk about custom is an accepted way of doing or behaving in a society or a community, or the way a person always behaves, or a habit or a practice. So custom hizi ni tamaduni. When you talk about taboo, hizi ni mira. But customs, these are tamadunis, the way people agree to be acting always within the society. And when we come to beliefs, this is the tendency of believing and trusting something that is right. So thinking that something is truth, is the truth, and it's lie, that is the real meaning of beliefs. Keeping all the trust into something, that is the real meaning of beliefs. So taboos, customs, and beliefs affecting pregnancy and motherhood. Before we move on, I would like to tell you that there are different taboos, customs, and beliefs that affect pregnancy in a positive way and other that affect pregnancy in a negative way. So we're going to promote those that affect pregnancy in a positive way, and we are going to discourage those that affect pregnancy in a negative way. So be with me to look a few at those that promote health during pregnancy and motherhood, and we should look at those that discourage pregnancy and motherhood. So you're most welcome to be with me. As I told you, taboos that affect pregnancy, we're going to look at some that discourage, that we should discourage, those that affect in a negative way on pregnancy and motherhood. Now, the first taboo is this one here. A pregnant woman is not allowed to eat eggs, goat meat, believing that the baby will be born without hair. So this is the first taboo that affects pregnancy and motherhood negatively. Because when you look at eggs and goat meat, these are foods that are important for the body, because eggs are protein in nature and they help in bodybuilding, whereby the mother needs to eat eggs during her pregnancy and during her motherhood, so as to make her body, so as to build her body. And the second taboo is avoiding eating green vegetables after delivering, as it causes abdominal distension. This thing, again, it's not right, because when you prohibit a mother from eating green vegetables just because she will get abdominal distension, remember that you'll be giving her or making her prone to anemia. Because these green vegetables, we have things like spinach. They help in production of blood within the body. When they are digested, they have iron supplements that are used with the body to produce or to manufacture red blood cells. So these things will make a woman high prone to anemia and be prone to malnourishment. So these things are negatively, they affect pregnancy and motherhood negatively. others are customs. Let us look at customs that affect pregnancy. These are positive customs that affect pregnancy and motherhood. The first one is providing less and high nutritious diet to mothers for 3 months after delivery. Some societies have this custom of providing enough rest to mothers after delivery and good food with nutrition. This is good because it prevents a mother from anemia and she gets enough time to recover and build her body. Another custom is breastfeeding for all mothers. This is good also, and at a certain extent it's bad because the child gets breast milk, which is vital for growth and development during childhood. Breastfeeding for all mothers is a bit good because it gives the little need for children. Babies, when are born from the first day to 42 days after birth, they need colostrum milk, which is the milk from the mother during the first 42 days. That contains all important nutrients for growth of the baby. But when we come to the second thing, that breastfeeding for all mothers is a bit also wrong because mothers who live with HIV are not encouraged to breastfeed children if their children are not given drugs. So this thing will lead to transmission of HIV from the mother to the child during breastfeeding. Another one is female genital mutilation. This is a negative custom that affects pregnancy and motherhood. Many people believe that circumcised women will not be prostitutes, that they prevent teenage pregnancy, and married women will go on out for their wedlock. So this thing is very dangerous and very bad. So it's highly discouraged to our societies because it causes unnecessary pain during giving birth and maximum bleeding during birth because the mother will have a scar on her genital areas. So when giving birth, it might rupture and bring excessive bleeding. So during delivery, it exposes the woman to third-degree tear, whereby she will bleed too much, leading to death. And also it reduces sexual enjoyment for the woman, leading to an unhappy life. As we know, during female genital mutilation, the thing that is cut or it is removed is the clitoris, and the real importance of clitoris is the part that senses hard sexual senses during sexual intercourse. So these are the three things that affect. These are the three customs that affect pregnancy and motherhood negatively during pregnancy and motherhood. So let us look at the harmful practices. These are things that are done. The beliefs are things that people believe in and do it because they think the thing is right. When we talk about customs, those are things that people need to do. And when we talk about norms, people believe that those things are to be in the same way. So when we talk about beliefs or practices, harmful practices affecting pregnancy and motherhood, we shall be looking at them as I will be mentioning some effects. The first belief is that it is believed that the use of traditional medicines during pregnancy will make the baby to be born per vagina easily, and this thing is totally wrong, whereby the mother is not allowed to use traditional medicine during giving birth. This thing is highly dangerous, whereby the mother is high prone to different things. So the using of traditional medicine during pregnancy will not make the baby to be born per vaginal easily, or will not help the mother to be born to deliver easily. Otherwise, it will bring other complications that are not necessary because the mother will not be in a good condition. Now let us see the effects that this thing will lead. The use of traditional medicines will lead to intrauterine fetal death, whereby the child may die easily within the uterus of the mother, because it increases the tone of the uterus, whereby contractions move more faster and the child can die easily. Another thing, it will lead to mental retardation of the baby, because those traditional methods, they do not choose the part to act. They can also affect the baby when they are absorbed into the body, they enter into the blood system, whereby through the blood system they move to the placenta. And if they are very dangerous, they can't be controlled to the placenta from getting into the baby's circulation. So they can also affect the baby's mental retardation. Another thing is maternal death due to poisonous in the blood circulation. Another thing is premature delivery, whereby the mother can deliver prematurely before time. Another thing is precipitate labor, whereby they make labor so fast before its time has reached. And another thing, due to the increased contractions in the mother, it may lead to rupture of the uterus due to excessive contractions. These things are very dangerous. You can see it has a lot of effects that are very bad to the mother. So do not support any mother to use traditional medicines during labor. Please, they are very dangerous. Another thing is packing the vagina with local herbs to prevent episiotomy during delivery. This thing is not right. Many women believe that when they pack local herbs to the vagina during delivery, they will prevent episiotomy during delivery. Episiotomy is that tendency whereby the woman is cut so as to increase the room of giving birth. Mwanamke kuchanwa ili njia ya uzazi iongezeke, hiyo ndo maana episiotomy. Kwa hiyo wengi wanaamini kwamba kupakia madawa ya kienyeji kuweka atasaidia kupunguza hicho kitu. Hiyo sio kweli. Otherwise it will bring more complications, as I mentioned. Another thing is presence of venous caseosa on the newborn. Baby is believed to be caused by sexual intercourse or during pregnancy. Hivi vitu sio kweli. Many people believe that when a baby has venous caseosa, zile nywele zile ule weupe unaokuwepo kwenye ngozi ya mtoto wakati amezaliwa ni kwa sababu ya mama alikuwa anafanya tendo la ndoa wakati ana ujauzito. Hii si kweli. Hii inapelekea kiasi kwamba ndoa za watu zinavunjika, inapelekea mama anapata pipelocycosis, tunasema ni kichawa baada ya kujifungua, yani ugonjwa wa kichawa baada ya kujifungua ndo pipelocycosis within the first 42 days. Akishapata ugonjwa wa akili ndani ya zile siku 42, that is pipelocycosis. Ila pia inapelekea it may dispose the man to multiple sexual partners, ambapo mwanaume anaweza kuanza kuchepuka na kwanza mengine. Kwa hivi ni vitu ambavyo ni beliefs ambazo zipo lakini si nzuri katika mazingira yetu. And another thing is a pregnant woman is not allowed to eat eggs, meat belief will be born with hair. Unaona? Kwa hiyo sio kweli, kwa sababu eating eggs is very healthy for a mother for bodybuilding, and eating goat meat is also healthy for the mother for as it will produce carbohydrates and other body nutrients. So it's very good for the mother to eat, whether before delivery or after delivery. Another thing is female genital mutilation, whereby this is very negatively, it affects the pregnancy and motherhood negatively, whereby it will lead to such things as I mentioned, whereby it will make the mother prone to pain and bleeding during labor, and it exposes the mother to third-degree tear, whereby it will lead to excessive bleeding until death, and it will reduce enjoyment during sexual intercourse, so the mother will always have an unhappy sex life. Another thing is prohibiting sexual intercourse during pregnancy. Basically we say during pregnancy, when it's 3 months before, when we say that it's 2 months before pregnancy, before delivery, is when the man has to stop prohibiting sexual intercourse during pregnancy period. When the mother is pregnant, at that time should a man stop having sex with the woman? Basically it's allowed since when she started conceiving until 2 months before delivery. The man is allowed to get into sexual intercourse with the woman. A man can have sexual intercourse with the woman 8 months when the woman is pregnant, 7 months when the woman is pregnant, except the last 2 months. We say this because those first 7 months are the safe months when the mother can have sexual intercourse. After the last 2 months, the mother should be left for delivery. But after delivering the mother, after 42 days of delivery, after 42 days after delivery, the man can have sexual intercourse if the woman is feeling good. So these things, it's according to situation. When the mother is not feeling good, you can leave her. But when she's feeling good and things are going on well, 7 months before pregnancy, the man is allowed to get sexual intercourse with the woman. And after delivery, 42 days, if things are going on, the mother is recovering properly, the man is allowed to have sexual intercourse with her woman. And keep in note, taboos, customs, and beliefs depends on particular cultural group of the people. So these things depend on the culture and tradition of the people. And some of them are good in pregnancy and motherhood, while others are bad. So as we say, they affect positively and negatively. So every society has got its taboo that affect it positively and negatively. And this thing affects them too much. So this is the end of our session. Thank you for your attention and watching. Please share, like, comment, and subscribe on our YouTube channel at Nursing and Medical Sessions. Yours at Public Health, Jacob Wilson, a registered nurse. I would like to say that thank you for you, my fan, for you, the person who you are watching these videos. Please, I would like to thank you very much for using your time, spending your time sharing with us, watching this short clip. So please, I would like to say that you're allowed to share, like, comment anything on our pages, so that we can get a lot of things and updates that we need, so that we can share with you. You're most welcome. Thank you for everything. Remember to subscribe to our YouTube channel. Please remember to subscribe so that we can move together and get different updates. You're most welcome. Thank you. May God be with you. I wish you a happy new year, a successful new year 2019. Thank you. You're most welcome. Bye.